My name is Jerry Barish. I am a 5-time cancer survivor and have been very involved in working with cancer environment and support since 1989. And still here, drinking our water, doing good things. So we will start. I'm going to ask Carrie Salagis, our legislator, to come up and do the Pledge of Allegiance. If you'll all stand.
Thank you. We all can stand, no matter what crisis we're going through. This is the best nation in the world. And so I want to salute to the great flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. I want to thank Jerry for allowing me to do the Pledge of Allegiance. I'm so looking forward to this event. Thank you so much, Jerry. Jerry, you've done so much here in Nassau County, and I want to thank you especially because when people from my district call me regarding cancer issues, I tell them to call Hewlett House, and it's a one-stop shop. They get all the support they need there. So thank you for all you've done. Can you give a round of applause to Jerry Parrish?
Well, we recognize Carrie A. I certainly want to recognize Assemblywoman Nikki Salagis. Nikki, thank you so much for putting this together. Do you want to come up? Of course.
Good evening, everyone.
Good evening.
Sorry, I have allergies, and whenever I take allergy medication, I get so sleepy. And I said, oh, I have too much to do. No one wants a sleepy assemblywoman. So I'm a little stuffy. I took a little Benadryl, and now, I'm a little stuffy, so I'm going to keep my comments a bit short. And I just want to thank you so much for coming here and gaining knowledge and information. Information is power. And as a community, we need to make sure that we have a loud voice in saying what we want. When it comes to health, when it comes to education, when it comes to even just having smooth roads, we need to make sure that we're a loud voice in getting what's deserving of our community. I'd first like to thank all our panelists for coming here and agreeing to be on this panel. Please give them a round of applause. And I'd also like to thank South Nassau for donating some of the snacks and foods that we have here. Thank you, South Nassau. It's a great community hospital. We appreciate what you do. They're always willing to do outreach, so we appreciate that. I also like to thank the commissioner for coming here and having a few words and talking to us about this issue that happens in our community. You know that Long Island has a high cancer rate. It's been said that there's some incidents of cancer here, and it's everything from prostate cancer to breast cancer. But that's around the country. We know that our environment has some effect on this. We know that some of the foods that we eat are not of the best caliber. There's GMOs out there. There's all types of chemicals that they put on the food. We can go on and pointing out risk factors and risks that attribute to these cancer incidences. But we have to take myth and fact and separate the two and organize each other so that we know what's best for our community. So I'm going to stop there because I'm about to lose my voice. But please take this information and share it with your neighbors. A lot of people couldn't come because there's a lot of things going on today in the community, but that doesn't mean that you can't call your friend and tell them, hey, I have more information for you. And most importantly, please get your cancer screenings. That's the most important thing that you can get out of this forum today. Early detection is the key. I heard a story today, someone just shared a story that, I'm going to just hint at your story, that she had stage 1 breast cancer, and she caught it very early on, and she didn't have to get chemo or radiation. She did get a mastectomy. And so that's early detection. That's what early detection can do. Because at the end of the day, we want to be with our families, we want to be with our friends, we want to be with our community. So please don't be apprehensive about getting your screenings. I know it's scary to know about it. I don't check my bank account sometimes. I don't know if I have enough money to buy that nice pair of shoes. That's a joke. But we have to know, and we have to educate ourselves and get screened. So I thank you so much. Have a great evening, and really thank you to all our panelists for coming. We appreciate you.
Before I introduce Vanessa, I just want to hook up onto what Mickey said about screening. Screening is extremely important, and if you hear about, oh, there's statistics and this incidence is so high in a particular place, you know, this is about you. And we are all individuals, and we're all genetically, you know, made up of different genes, and some of us are predisposed, some of us are not. And that doesn't mean we're going to come down with cancer, but we can reduce our risk as much as possible if we know how to do that. And screening is one of the most important things. I'm not somebody who's very diligent about the numbers of statistics, because to me, if you have cancer, then you have that statistic, and that's one too many. So you need to do your screening, call the coalitions, call the hospital, the health department. You will get a lot of info tonight. Vanessa. Vanessa is from the Nassau Queens Partnership. She'll be speaking to you for a few minutes.
Good afternoon, everybody, and I want to thank Ms. Salages and also Mr. Salages for giving me the opportunity to speak with you about a project that we are currently doing. So my name is Vanessa, and I have my colleague Marianne, who speaks Spanish, in the back. So would you please wave? Marianne, very good. So what we're doing, the PAM project, is that the purpose of the project, which is called the Patient Activation Measure, it is to reduce the emergency room use and also to increase active engagement in one's own healthcare. So the way we do that is we target different areas in Nassau County, such as Department of Social Services, different read centers, and in Hempstead and Glen Cove. And what we do is that we target specific population, the ones that are uninsured, emphasizing that help will be provided to anyone who is uninsured regardless of their status, meaning that if they have green card or if they are citizens of the United States of America. We know that it's very important for one to be healthy. So our goal as health coaches is to connect those individuals who don't have health insurance to different health centers in their community so that they could be seen by a primary care provider for a low cost. So rather than going to hospital or to an emergency room and wait for a long time, so we refer those people to different health centers in their community so that they could be seen for non-emergency reasons, routine and preventative care, instead of going to the emergency room. So I have some resources in the back, so when you finish, you'll be more than happy to join my colleague Marianne and I in the back. I speak French and Haitian Creole, and Marianne speaks Spanish. If you have a family member or a relative that you would like to recommend, or if it's yourself, please see us after. Thank you very much.
Thank you, Vanessa. Dr. Eisenstein, our Commissioner of Health of Nassau County.
Woo!
It's nice when people are excited to hear you speak, so thank you, Legislator Salages. And let me begin by thanking Legislator Salages and Assemblywoman Salages. We have partnered on numerous events over the years. You've both been great partners of the Health Department and friends of good health, and as one of the health officials in the state who goes to Albany and lobbies on behalf of health departments and preventive health around the state, it's wonderful to have somebody in Albany who's receptive and understanding and, quite frankly, gets the unique needs that Nassau has. The majority of New York State falls into either New York City or the many, many, many agricultural counties to the north. And the fact is, we are a suburban county. It's got its own niche. We have different needs, and we have great advocates here. And so I want to thank Legislator Salages, Assemblywoman Salages, for being great partners of health. Jerry Barish, who's hosting this, some of you don't know her. She's very humble. She always talks about being a cancer survivor 5 times. But what you don't know is how many thousands of people she has supported as they've fought cancer. And Legislator Salages talked about how important the Hewlett House is. The Hewlett House is a historic building. It's a protected historic building. run solely by volunteers. Jerry is officially part of the health department, but has been running Hewlett House for a long time. And it's amazing that we have a unique place in Nassau County where people can get support services when they're suffering from the horrors of cancer. And Jerry is a tireless advocate. There, and I'm not exaggerating when I say this, she is probably one of the leading cancer advocates in the entire United States of America. And if you don't believe me, go by the Hewlett House and very subtly on the shelves and in the corners, see how many photos there are of her with prior presidents of the United States, United States senators, members of Congress. Jerry Barish is a name that is known in Washington and all across the country, and nobody has given more in this county for helping people with cancer than Jerry, who is selfless, and we're so proud of her. The health department, we are here to serve you, our residents. We always appreciate the opportunity to interact with you, to provide information, to be a resource. And we hope you will use us as a resource when you have questions, concerns, you want to know what's true, what's not true, you want to know how to access any kind of health services. If we don't provide it, we certainly can point you in the direction of where to get it. And I am blessed to be a health commissioner of a department that is so full of so much expertise. All of the speakers on the panel tonight are the best in their field, the brightest, and you're going to hear from them. And I can certainly attest for the two from my department, there's nobody better in the state or in the country. And we get calls from health departments across New York State and even across the country asking for advice. How did the people in your department do what you did? How did you accomplish what you did? We just, this week, were notified that we're winning more National Model Practice Awards. We've won more since 2013 for providing public health services than the rest of the counties in New York State combined. There are 58 other counties, and that includes New York City. And that's not me doing the work, it's me proud of the people in my department who are doing the work, including the people that you're going to hear from tonight. So please, use us as a resource. We'd rather you call us and find out, get real answers to your questions, rather than wonder what's true and what's not true, rather than wait until, oh, maybe I'll take care of this problem next week. We know with cancer, the sooner you find it, the better the odds are that you'll survive. And we have an incredible healthcare infrastructure in Nassau County. Think about it. The county's only about 450 square miles. We have 10 world-class hospitals in that 450 square miles. There are resources, there are over 8,000 licensed practicing physicians on top of all the other medical providers that we have. And I am so delighted that we have the Long Island Federally Qualified Health Center serving our residents in Nassau County. And you have in Elmont, besides one of the most amazing libraries I've ever been in, and this building is always, whenever I'm here every once in a while to speak, I'm always in awe because this building is just an amazing place for the community to have. And so we're very lucky to have this. We also have Federally Qualified Health Centers. When they started, there were 5 of them. They're up to 11. And Dave, is the second one open yet, and down the street in Belmont?
On the Belmont Park, yeah.
So you now have in Elmont 2 of the Federally Qualified Health Centers, one on Hempstead Turnpike in Elmont, and one recently opened in Belmont Park to take care of the residents who are working at the racetrack. But the executive director of the Long Island Federally Qualified Health Center, who's been a wonderful partner, David Nemiroff, and he and I speak probably monthly on ways to collaborate and communicate. And when people say what resources exist in the community, on the night when my beloved Jets are probably going to get a new quarterback in about 45 minutes, I'm not watching on my phone, I promise, and on a night when the Giants, if you like them, are going to have a new first-round draft pick, I'm going to ask Dave to come up and talk about a grant that the Federally Qualified Health Center received, which is the National Football League's Prostate Cancer Screening Grant. That was won right here in Elmont, New York, across the street. And so with that, we hope you enjoy this evening. We hope that you learn from this evening. We hope that is the beginning of the discussion, not the end, and the health department is always available to you. And I will turn it over, if you don't mind, Jerry, I introduce David Nemiroff, the Executive Director of the Long Island Federally Qualified Health Center.
Thank you, everybody, and I'll be brief because I know you're here to see them, not us. So, yes, I'm fortunate enough to lead an organization. My Chief Medical Officer is here, Dr. Strigan James, our board member, Sister Evelyn Lamoureux is also here. We were fortunate enough to apply for a grant and were able to purchase the building right across from Gate 5 last year And in there, we just got a fully renovated building, so you should come by and see it. It's beautiful, and we do a lot of preventative healthcare screenings. And we were awarded a grant from the American Cancer Society and the NFL called the Crucial Catch. And it's really about cancer screenings. So it enabled us to hire a navigator to help us to bring people in, to outreach to the community so that we can reduce the incidence of cancer and really screen, as you heard everybody say before me, to early detection is the key. But our site has full comprehensive primary care. We offer dental, behavioral health, nutrition, OBGYN services at a WIC office in the first floor of the building as well for new moms. So it's really a comprehensive and amazing facility that has gone through amazing transformation. I think folks who live in the community know, I think once it was a wedding chapel or a place, a banquet hall years ago. So you should see what it looks like now. And we are here to hopefully help improve the health outcomes in Elmont. Our annual report will be up in a couple of weeks on our website, and it's about getting better health outcomes for folks by these preventative screenings. So the cancer grant really is a wonderful opportunity for us, the health department and the NFL, to reduce the incidence of cancer. You may see up at the back table there, we just have a little postcard, so feel free to find out more about it so that I don't take up your time. But we are actively engaged here in the Belmont racetrack, those backstretch workers, to help get better outcomes for our neighbors. And we've improved towards national benchmarks in almost every category, including cancer screenings. And for those folks not aware, we affiliate with National University Medical Center that brings a mammography van once a month to the health center as well, so you don't have to go to someplace to get mammography testing. So we do that as well, right on site at the health center, right in the parking lot. We bring a big huge RV to help the community. So these are just some of the resources we have for you, and if there's any questions, you can ask us afterwards. Thank you.
Thank you.
Yeah, so you come to these things, you learn something every day. It's great. Let me introduce Robin Swartz and Bob. You could just, instead of me reading all these bios, you could give a couple of sentences about how important you are.
Want me to do it from here?
Whatever makes you happy.
All right, I'll do it up there.
Okay.
Good evening, everyone. My name is Bob Swartz. I'm the Chief Engineer for the Water Authority of Western Nassau County. I'm a licensed professional engineer in New York State, and I also hold a grade 1 water plant operator certification I'd just like to give you an idea, some facts and figures about the Water Authority that you may know, may not know, just to get a feel for the size of our area. The Water Authority began in 1996. In June, we started operations. We started the operations of the Nassau section of the Jamaica Water Supply. We have a service area of about 11 square miles, and we service Elmont, Franklin Square, South Floral Park, Stewart Manor, Belrose, New Hyde Park, and parts of Franklin Square, Garden City, Valley Stream, and North Valley Stream. Kind of sounds like a Long Island Railroad train stop schedule. We serve a population of about 120,000 people, and we have service connections to about 28,000 buildings and residences. All of our water comes from 24 wells that are located in 15 sites throughout our territory, and they range in depth from about 87 feet to 277 feet below grade. We have 7 water storage tanks that hold 12 million gallons of water. We have 3 elevated tanks and 4 ground storage tanks. And we have 234 miles of water main that we take care of. One of the problems that we had in the past was iron-related problems, especially in the Elmont and Franklin Square area. On Long Island, as you approach the South Shore, the levels of iron in the groundwater increase. And we found that from Hempstead Turnpike on south, the iron levels were higher than the areas that we serve in the northern area of our district. Iron's not a health hazard, but it is an aesthetic issue, and it can cause water to become red and orange. I'm sure quite a few of you have seen that over the years. We have 5 wells in Elmont that have higher levels of iron, and in 2012, we had 2 iron removal plants installed, one in Elmont and one in Franklin Square, and they remove iron from water in 3 wells. We have another one under construction right now for a 4th well, and that's scheduled to be completed by the beginning of next year. The water coming out of these iron plants contain no iron in the water at all, and we've seen quite a decrease in the number of calls to the office about iron issues since we put those in operation. Another issue we had in 2006, we have 4 wells along Hempstead Turnpike south of, on Elmont Road south of Hempstead Turnpike, and due to increased levels of volatile organics, we had to shut the wells down until we had treatment. We did start construction, and we should be starting a new treatment plant that should be in operation probably the beginning of June this year, which will take care of 2 of the wells. And while those 2 are in service, we'll have another treatment plant to take care of the other 2 wells. So they'll be coming out with clean water out of those sites. And I'm sure you've probably heard about 1,4-dioxane's been in the news recently with the EPA's unregulated contaminated rule. And we have one station that has elevated dioxane, and we received a grant from New York State Governor Cuomo's office to build a pilot plant to study the removal of that. And we're going ahead, once the pilot's done, we're going to go ahead with full construction on that. It's not a cheap process. We figured roughly about $3 million just to build the plant, and they say the cost to operate the plant on a yearly basis could run between $500,000 to $1 million, which is quite expensive, but that's the price of safe water sometimes. Now the dioxane, it's a solvent used in manufacturing of other chemicals, and it's also a trace component in some cosmetics, detergents, and shampoos. I think a lot of those products have had the dioxane removed from their things recently. So, and if you have any questions, anything, I'll be glad to help. Okay. Okay. Sure. Okay. And that's enough for me for now. Thank you.
And I know I gave my remarks, but there's one more remark that I absolutely should describe and discuss with you. And the fact is, we're here to make sure that government is addressing the concerns of the community. I know that there have been concerns about the rates of cancer in the Elmont community. I, as the health commissioner, take this very seriously. Both of my parents died of cancer, so I have both a personal feeling about it, as well as a responsibility as your commissioner of health to keep you informed, provide information, and we have the experts to provide you that proper information. And I want to really assure you something so important, that I've discussed all of these issues and had the great opportunity to present to our new county executive, Laura Curran, these issues. She has, in the first few months that she's been the county executive, given unwavering support to the Department of Health. And along with that, Deputy County Executive Kyle Rose Louder of Health and Human Services, who I report to and has been also incredibly supportive from day one of the health department and is always there for us, is here. So I want to acknowledge Deputy County Executive Kyle Rose Louder.
Thank you.
Thank you. Back to you, Jerry.
Thank you. Welcome, Deputy County Executive. Our next speaker will be, not too good at this, I usually yell a lot, so. Chuck Nace.
Good evening. My name is Chuck Nace. I work for the United States Environmental Protection Agency. I'm an environmental toxicologist that works in our Superfund program, which a Superfund program, we handle hazardous waste sites across the nation, and they tend to be the ones that are the most complex or the most contaminated that either states or local governments can't take care of. So that's kind of what I do. We look at data that is collected from these sites and we evaluate it to determine if there's an unacceptable hazard and if a cleanup is needed and then what type of cleanup is needed.
Hi, Michael Skorka. I also work with the EPA. I work in the same section as Chuck. We are in the technical support section. I am a hydrogeologist, and I'm assigned to several sites in New York, Long Island, and upstate New York, and also New Jersey. And my role is to evaluate the hydrogeology, soil contamination, and the groundwater transfer.
Laura Buckman, who's the Director of the Division of Epidemiology and Planning in Nassau County Department of Health.
Good evening, I'm Laura Buckman. I am the director of that division. Just as a little bit of background, epidemiology is the study of diseases in populations. So it looks at large numbers. It's not clinical, it's not one-on-one that you can see with your own physician. This is a larger, looking at a larger swath of the population. So hopefully you'll learn something tonight and I'll be able to convey the information well to you. Oh, I thought Don was going to say. Okay, well, okay, sure. Yeah. So now I'm going to speak. So thank you so much for inviting us to come here. And before we get started with looking at numbers and some data relevant to Elmont and Nassau County, I think it's worthwhile to first talk about factors related to cancer. Now, these are not necessarily singular causes, right? We all know, or at least I'm sure you can think of people who smoked and developed lung cancer. And we all know that association. It's been well documented in the literature, right? Don't smoke, don't get lung cancer. However, I'm sure you all know people who smoke and don't get lung cancer. Or the vice versa, which is people who get lung cancer but never smoked, right? So there are multiple causes, there are underlying reasons, there's a combination of factors that can exist that contribute to when we see cancer in patients. So this first slide is an example of just some of those factors. For example, obesity has been related to cancer. Diet has been known to be protective of certain kinds of cancers. Sunlight related to, for example, skin cancer, alcohol to liver cancer, and these factors will all interrelate. But what's perhaps one of the largest factors is family history and genetics. That is one of the strongest predictors of cancer. And so that's something we all have our own individual ones, right? But together and among and between, they all act to, unfortunately, contribute to cancer that we see. Thank you. So first I thought we should look at some cancer trends over time. What we're looking at here on your left are what's known as incidence rates, and on the right, mortality rates for different types of cancer. These are the 4 most common cancers in New York State. So we're talking about colorectal cancer, lung and bronchus, female breast, and prostate cancer. This data is collected by New York State Department of Health. So New York State up in Albany collects data from every physician who diagnoses a patient with cancer and every physician who has a patient pass from cancer. And all this data is collected over many, many years. You can see we have data back decades in the 1970s. And they collect this data, they analyze this data, and so this is obviously data for Nassau County, but all this information is regularly cancered and kept in what's known as a cancer registry. All right, so back to the graphs. Incidence rates mean first diagnosed cases. So these are newly diagnosed cases of cancer. And as you can see in Nassau County, there's a varying rate depending on the type of cancer. Prostate cancer increased and then recently decreased. But depending on the type of cancer you're looking at, you will see a varying rate. What is the message and perhaps the most important aspect of this graph are the mortality rates. Because if you look at that graph, all of these lines are going down. We are seeing rates of mortality decrease, especially in the last 15 to 20 years. So what is that telling us? Why do we see perhaps varying rates of newly diagnosed cancers, but decreased rates of mortality? Well, maybe it has to do with screening. And there's a lot of evidence to suggest that the more screening that happens in a community, in a geographic area like Nassau County, the more you might see these very increase in rates, but that early screening, that early detection is leading people to seek care, get medical treatment. Medical treatments are more and more, they're more effective, and what we are seeing is a decrease in mortality rates. And that's really what I want to emphasize from these graphs. Mortality rates means the death rate.
And to Laura,
Yes.
I want to jump in because you said
Yes,
I'm allowed to.
I did say, Jerry, I'm glad you jump in.
It's that she's so right. You need to digest what she's saying. We are living longer.
People are living into their hundreds, driving at 95. But the fact is that we are being screened earlier. We know who we are, where we came from, all of the things that we teach about yourself. You go for treatments, you go for early, to be screened early. The earlier you find something, the more you know about your family, your parents. This is the reason why there is maybe so much cancer. Why people are saying, well, why are there so many people that are so young? We look at the histories. We take a person and we look at the history and their background, what they live on, what they're surrounded by, and we put all that together. And that's how that early detection is, and we are living so much longer. So when you see something, I don't want you to be frightened, because years and years and years ago, we thought we were the highest in the country in breast cancer. We all thought we drank the water, that's why we were all so sick and we were dying. We knew nothing. We didn't know anything about genetics, who we were, where we came from. We learned about registries that said, you know what, if you live in a particular area and you're diagnosed in that area, you're in that registry. If you live in that area and you're diagnosed in another state or someplace else, you're not in that registry. So it's about it's about education.
So thank you, Jerry. In keeping with this understanding of why it's so important for early diagnosis, this is a graph, actually two graphs, that compared cancer incidence by sex and race in Nassau County to that of New York State. And the reason we are looking at these graphs, I should say, is because epidemiologists often try to understand demographics as it relates to who's getting cancer, or whatever disease, in this case, this is what we're talking about. And what we see here, and I'm sure you can see it right off the bat, is that the patterns between Nassau County and New York State are identical. They really follow the exact same shape, and so what we have here is a higher rate of actually prostate cancer in black males, and a higher rate of breast cancer among white women. All right, so there is a difference that is clear in these slides, but it is similar between both Nassau County and New York State. So what we have in Nassau County mimics what's going on in the state and actually mimics what's going on nationwide. All right, so now talking about Elmont. This is just a slide to review the demographics of Elmont, which of course you're all familiar with because you live here, but it's worth making a comment about and giving context in the next couple of slides we have. So the first is age distribution, and that's important, right? Because we expect to see cancer, in some cancers at least, in the older population. So data needs to account for age. That's important. In Elmont, the largest proportion of age includes the 20 to 44-year-olds. In terms of sex, right, we also see differences in cancers among sex sometimes. It's about 50-50 in terms of this population in Elmont. And in terms of race, the black population is 45%, followed by whites at 30%, Asian 11%, and other, which is either a combination of races or an other race, includes the 14%. So keep these numbers in mind when we look at the next slide, which is specific to cancer in Elmont. Okay, thank you. So this is Elmont-specific cancer data for 5 years between 2009 and 2013. This is data, again, that's collected by the Cancer Registry in New York State. That's important because I'm going to move on and talk about this. The first column is cancer site. The second column is the actual number of cases, the total number of cases in Elmont per cancer by sex. The third column is a calculation. This is an estimate that New York State determines by a calculation, which is based on the population, Elmont. It's based on the age distribution of Elmont, and it's essentially adjusted by the New York State Department of Health rate for each of these respective cancers. It's a calculation, it's an estimation of values, okay? So we have the actual values, and we're comparing them to what New York State would expect to see, given New York State's rate of these various cancers and the specific demographics of Elmont. And then the final column is a New York State designated category, which essentially is a way for the state to monitor the actual cases versus the expected cases. All right, so let's look at prostate first. The actual number of prostate cancer cases in Elmont was greater than that of expected. And so New York State classified that value as 15 to 50% above expected. In the case of breast cancer, in fact, the number of cases in Elmont was fewer than what was expected. And so that was considered within the 15% mark by the state. Colorectal for both males and females were less than what the state expected to see in Elmont, and so they categorized that as below expected. And finally, the same was true with lung cancer. Both males and females there were fewer cases of lung cancer in Elmont compared to what the state expected. And these numbers that we see in Elmont are similar to other communities with similar demographics to Elmont. Okay, thanks. So what does this mean for you, right? What's your question? And so hopefully this will help to answer some of it. Does my chance of getting cancer increase because I live in a zip code that has a higher incidence of cancer? And the answer really is no. Just because you live or lived in a county or a zip code that has a higher incidence of cancer, you are not more likely to get cancer than someone who lives or lived in an area of lower incidence. And why is that? Because this goes back to my first slide, right? Because cancer is a combination of factors. It's a combination of things like lifestyle, like smoking, diet, genetics, family history plays an important role in the development of cancer, contact with cancer-causing substances like sunlight, x-rays, smoking, other chemicals. And so the real take-home message that we want to convey, and I think really what the graphs support, is that screening, early detection is the key to decreasing mortality or death due to cancer. And so, you know, I hope we've given you some additional information to take home about that. Now, if you have further questions about cancer data, let me first point you to this URL, this website address. This is up at New York State. In addition, you can also email New York State Cancer Registry, and specifically on their website, they say if you have questions pertinent to your community, please email them directly, and they will speak to you and they will, you know, address your questions.
Director, quickly, I just have a question. My name is Carl Clay. I live in the community. My question is, your averages are from 2013. It's now 2018. That's 5 years.
I'm happy to answer that question, but we're going to do this at the end, okay? But I got your question and I will respond, okay? Got it. All right, so next on tap is John Irwin, who's our Director of Environmental Health from Nassau County Health Department.
Thank you, Deborah. I appreciate the opportunity to speak with you tonight about your water supply, about your drinking water. And it's my hope that I can instill confidence in that you will go home tonight and turn on that cold water tap and take a nice big glass of water and drink it, because it's really the best thing for you. Where does your water come from? As Bob mentioned, all of the water in Nassau County and in this community comes from groundwater wells, comes from beneath us. Now, it's our job in the health department to make sure that that water that's delivered to you, to all the homes, the businesses, the hospitals, the nursing homes, that it is perfectly safe for you to drink, to consume, to shower in, to do whatever you need to do with making coffee or tea. Now, how do we do that? We do that by sampling the water. And we don't just sample it once or twice. We sample it many times in many different places. We sample it when it first comes out of the well. So we know exactly what the water quality is of that water, that groundwater that's coming out of the well. Now, all of the water gets treated to some extent. We have to raise the pH so that it's not corrosive and it doesn't eat away at your pipes. We add a little bit of chlorine so that it's disinfected and no bacteria can grow in it. That keeps everyone safe. We sample the water after that treatment. Okay, some of the treatment sometimes has to take out some chemicals. And we also sample it out here in the community, in the distribution system. So we sample it in multiple places to ensure that the water that's being delivered to you is safe to drink. And if we find a problem, we take immediate action. We sample the water depending on the contaminant or the chemical or the constituent in the water at different times. Some of the sampling is done weekly, like for bacteria. Some of it is done monthly, quarterly, sometimes yearly. Okay, it depends on what it is we're looking for. In Nassau County, the water suppliers and the health department do so much sampling. There's over 250,000 water quality tests that are completed and reviewed by the health department every year. And in this community, that's thousands of samples and tens of thousands of sample results that we look at. We go through each result to make sure that it meets the water quality standards of the EPA and New York State. Now, how do we enforce that sampling? Well, we make sure that all the sampling that's supposed to be done is being done. And if it's not done, if the water authority or any other water supplier misses a sample, they have to go and sample immediately, and they have to notify you at a specified time that they missed a sample. Now, there are some of the water quality parameters that are more stringent in New York State than what the EPA requires. So New York State's a little more restrictive than the EPA, and in Nassau County, we do a lot more sampling than even the state says needs to be done. So we collect all those samples. What happens next? They're taken to a laboratory and they're tested. They're tested for physical characteristics, they're tested for bacteria, all kinds of chemical contaminants, and radiologicals. And each of those needs to meet a certain water quality standard for it to be acceptable. Those water quality standards, most of the contaminants or constituents in the water have what's called an MCL, a maximum contaminant level. So the EPA has done many, many health studies that say, okay, for this particular chemical, let's just say benzene, for example, which is a chemical in gasoline. The most that the water, your drinking water can have of that contaminant is 5 parts per billion. A part per billion can sometimes be tough to wrap your head around. It's a very, very, very small number. It's equal to 1 second in 32 years. It's a very small number. Now, the water supplier and the health department, we're not satisfied. We're not going to say, okay, there's only 5 parts of this contaminant in your water. We want to get it down to where it can't even be detected. That's always our goal. Those, you flipped ahead. Those MCLs, what do they really represent in terms of a health risk? And the EPA can probably talk a little more about this if you have any additional questions. But generally speaking, those MCLs would represent that if you were to drink that level of contaminant over your lifetime, that it would raise your risk, your health risk, 1 in a million. Now you're drinking the water. We all drink the water. We live here. We raise our families here. You have the right to know what's in your water. And that's why the annual water quality report that every water supplier is required to publish and send to you and publish on their website comes out every year. The 2017 report will be out very soon. It has to be out by the end of May. And it tells you exactly what testing they did. It gives you a lot of information about the water supplier. What testing they did, what they detected, and what actions you're taking to improve the water system, how your money's spent, how much the water costs. All of that information is in your annual water quality report. And the Department of Health looks at those reports before they're sent out to you. So our job is really to make sure that the water is safe, so that you can be confident that the water that comes out of your tap is healthy and safe and perfectly good to use. As I said, in Elmont, there's thousands of tests and tens of thousands of results every year. The testing is done for over 150 different constituents or contaminants. Those results are reviewed by the laboratory, by the water supplier, and by the health department. So it's very, very uncommon for anyone to miss something. Now let's say we do find something. We say, hey, here's a well that we just had a slight detection of freon. What are we going to do? We're going to tell the water supply, you have to start sampling more frequently. We're going to tell them exactly what they need to do. We'll alert the DEC to say, you know, is there a possible source for that contaminant? We're going to watch that. We're going to watch that water quality and make sure that it doesn't approach the MCL. If it does start to approach that MCL, we're not going to wait for it to get to the MCL. We're going to say, all right, take that well offline until we can figure out what's going on and make sure that you have a safe water supply. So, as I said before, we're not just willing to let the water go out at the MCL. We always strive to do better. Now, the other thing we do is that, you know, the water system needs to add treatment or put a new well in. All of that work has to get reviewed and approved by the Department of Health before they do it. Because we want to make sure that whatever they're going to do, it meets the standards, it's going to be done correctly,